What is the connection between upper cervical chiropractic and low back? The term cervical, if you're not familiar with it, refers to the neck. So the bones in the neck, the vertebra in the neck. So it's not that difficult to make the jump from I have neck pain to upper cervical chiropractic might be something that can help me get rid of my neck pain. On the other hand, the connection between upper cervical chiropractic or upper neck chiropractic and low back pain is not always as clear. But believe it or not, most upper cervical chiropractors see far more low back pain cases than they do neck pain cases, probably because it's just a much more prevalent problem. So if you're one of the people out there dealing with low back pain, but you're just not quite sure how to square the idea of fixing a problem in your upper neck in order to fix your low back, I think I can make that a little more clear for you. There are 4 points that I would mention that if you can understand those, it makes that connection much more clear. Number 1, there is an area in the lower part of the brainstem, the upper part of the spinal cord, called the reticular formation. Among other things, the reticular formation controls postural muscle tone and coordination. Number 2, the misalignment that we deal with in upper cervical chiropractic alters, it can do a lot of things, but what it always does, it alters the ability of the reticular formation to properly control muscle tone and coordination. And number 3, when this happens, you have this alteration in spinal muscle tone, especially the spinal extensor muscle. And this alteration in muscle tone ends up causing a postural distortion of the entire spine and pelvis. Number 4, when this is present, we can visibly see a disparity in functional leg length, and we can measure a tilt in the pelvis. And this, on top of the already imbalanced musculature, can place a large degree of mechanical stress on that lower back and pelvis. So you can adjust directly that low back and that pelvis, and very often that will help. But if you don't correct the upper cervical spine, you're going to continue to have that alteration in postural muscle tone, and most of the time you're going to continue to struggle with low back, pelvic, and hip pain. However, if you correct that upper cervical misalignment, and you do that properly, that allows the rest of the spine and the pelvis to adopt a normal structural postural position because you've gone straight to the source of the problem.